Hello and welcome to the Wise Empathy for Negative Emotions video. Thank you for your time. Modern medical training places empathy at the heart of providing quality patient care, yet different parts of empathy have different effects on medical providers and patients alike. Here, we will describe which parts of empathy are beneficial when encountering negative emotions. Empathy has three distinct components: emotion sharing, feeling what others feel; perspective taking, understanding how others feel; and compassion, feeling warmth, care, or concern for the other. These components activate distinct neurological networks and have different effects on the empathizer. Accumulating data shows compassion is the most effective and sustainable response to patients' negative emotions. Compassion for negative patient emotions allows providers to remain engaged and deliver effective care without absorbing these negative emotions themselves. This is key because evidence shows compassion is strongly associated with reduced burnout in providers, while negative emotion sharing shows the opposite effect. It is important to acknowledge that feeling what others feel is a natural, often automatic process, especially for medical providers. However, research shows that sharing negative patient emotions undermines provider well-being, compromising their ability to deliver care. In addition to benefiting providers, research shows that when patients feel negative emotions, feeling compassion is critical for quality patient care. Patient care is rated higher when providers show compassion for their patients, but not when they share their negative emotions. Further, when people feel compassion for their negative emotions, they feel more valued, cared for, and understood. Based on this research, we suggest you try to focus on compassion for negative patient emotions. Imagine you are about to walk into a room with a life-changing diagnosis you know will be very upsetting for the patient. Before you enter, you could set a goal about how you want to feel during that conversation. You could think, "I want to focus on caring more than sharing," or "I want to feel compassion rather than feeling what the patient feels." Research suggests simply setting that emotional goal is often very helpful. When you notice you're sharing the patient's distress, notice this without judgment. Then, take a deep breath and remind yourself this is their emotion and not yours, and that you and your patient will be better served if you focus on compassion rather than feeling what they feel. With this reminder, gently shift your attention back to compassion. You might think, "This is their sadness, not mine," and focusing on compassion is best for both me and the patient, or whatever feels right to you. As you practice, we suggest you have compassion for yourself as well by being kind to yourself, remembering that you are only human too, and you are doing your best to help others with the time and resources you have. Happiness and pain are both parts of the human experience we all share. How we respond to others' suffering shapes how it affects us. As a medical provider, you face suffering more than most. Responding to negative emotions with compassion and without sharing them too deeply is key to empathizing wisely with your patients. Thank you for watching our video about wise empathy for negative emotions. You can watch this video again in the app whenever you choose. Listed are the sources we used to create this video. Thank you and good luck.